Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy Studio on our regularly scheduled podcast on Monday morning. Afternoon, I guess. I am excited to have I'm used to saying that, Jeffrey Zavada from AMPS. And he's going to be discussing price transparency in healthcare. And as we work on getting him logged in, I want to just mention a few things. Healthcare is like no other animal. You check into a hotel and they give you a price. They know what the price is going to be. That's not the way healthcare works. You have no idea what the price is going to be usually. Now, that doesn't mean that it has to be that way. That's why we're going to have Jeff on here to talk about that. Is that price transparency for healthcare can be transparent. Jeff, welcome to our show. Let's see if we can log him in. Jeff, welcome to our show. We were just talking about transparency and healthcare pricing and how healthcare is like no other animal. So tell us how you guys make that different. Okay, we can't hear you. We can't hear you. No audio.
Well, while they're working out that issue, I think all of us as consumers have went to our doctor or to a pharmacy or to a place, an imaging place, or just to receive care, and you get a blank look when you ask how much something is going to cost, and which is kind of crazy because when I went to my dentist and I needed something accomplished, I get a quote before I ever go forward. So it is possible, and it does happen, and your chiropractor is the same way. Usually they give you a quote before they ever proceed.
Yeah, and we're working at getting Jeff established audio. Jeff, are we have you on audio yet? Can you hear us, Jeff?
I don't think he hears us.
Yeah, okay. Okay, let me try something.
So anyways, from a consumer point of view, it's very frustrating because we have lived in this short space in time, because really when, I grew up, my parents were able to go in and make an appointment with the doctor and pay the doctor directly, and we knew what the office call would be, and then if we needed something extra, the pharmacist knew how much perhaps the treatment would be before we proceeded. And now we've kind of gotten into this era of where insurance companies, hospitals, and big corporations have all taken over, and so the transparency is not there. And so it's really hard for consumers to wage through it, because the answers we get when we talk to the clerk or the person at the desk, or for example, I needed some labs drawn last fall, and in order for me to get a price, they're like, well, you just need to do the labs and then we'll let you know. And we're like, no, this is cash today. How much would you charge me? And they really didn't know. Imagine going to the grocery store and they didn't really know how much the food was going to be. I mean, it's just ludicrous.
Yes, let's go ahead and get Jeff back logged in. Jeff,
All right,
how are you?
I'm
There
doing
you
well.
are.
How are you guys?
I love it. I love it. We're doing well. And we were just talking about transparency in healthcare and how it's like no other animal. I mean, nowhere do we go, whether it be a hotel or the grocery store, do we go in and not know what something's going to be before buying it. So tell us how AMPS is different, and tell us a little bit about a history of transparency in healthcare or non-transparency in healthcare. You go.
Yeah, I think, first of all, it's great to be here, and I appreciate the opportunity. So AMPS, we're all about changing healthcare by paying the right price for the right services at the right time by the best quality provider. And it's amazing. And following up on what y'all said is, nobody knows how much things cost. You can go across the street from one hospital to the other for the exact same procedure, and the variation in pricing is ridiculous. The other thing is the variation in quality is ridiculous. And I use, the food chains like McDonald's, where it doesn't matter if you're in Paris or Boise, Idaho, a quarter pounder tastes like a quarter pounder.
Yep.
It's the same exact product, the same price. And yet with healthcare, the things that are even more important to us than food, right? You can have two physicians who graduated from the same medical school at the same class, even did their residency at the same location, and the way they perform the procedure and how much they charge for it is completely different. So what AMPS does is we reprice a claim based on Medicare, right? The government has already told us what they think the fair price is for services based on a Medicare allowable. And so what AMPS does is we take that claim in, that bill or invoice in from a member, and we reprice it and pay the provider based on a Medicare allowable versus what their bill charges are. And we see tremendous variation. In the state of Texas, as an average, 868% of Medicare is what the average hospital bills at. 868%. And within that 868%, you have some that are billing at 4,000% of Medicare and others that are billing at 250% of Medicare. The point being, the variation is incredible. And the results for the same procedures across the spectrum of healthcare are also incredible.
And one of the most unfair things about this is that these hospitals, usually it's hospitals that are the most guilty of overcharging, and they never get paid that, and they know that. So but the unfair part is when they bill 4,000% of Medicare, the person that is self-pay, they're the ones that really get hit hard because they're the ones that are supposed to pay that full amount.
Yeah, and so the same individual who self-pay, though, a 45-year-old male spends 8 to 10 hours researching his next flat screen TV, how many pixels it has, how smart the TV is, can he load onto Disney and Sports Center and all that. And that same 45-year-old male who's told he has to have triple bypass surgery does little to no research on his cardiovascular surgeon or cardiologist. He does little to no research on the hospital's performance and outcomes, readmission rates, complication rates, et cetera. And so, it's easy to say it's all the healthcare providers' fault, but it's just as important to understand that Americans as consumers of healthcare are responsible for doing a little research ahead of time. My wife and I were in Canada last week. We were up at Niagara Falls, and we went to the Canadian side, and we were watching the Canadian news, and my wife's also in healthcare. And there was a stat on TV about Ontario that this year so far, 2,935 people have died in Canada waiting for surgeries or tests to be preferred because they don't have enough capacity to serve their community. So you think about the full, the other end of the rainbow, which is national health care. National health care in Canada is killing Canadians because there isn't enough beds to serve people. They can't get MRIs or CAT scans done in time to save their people. And so what's the answer, right? The answer is somewhere between the broken American system and the even more broken Canadian system. But I think it really starts with, first of all, consistency in the delivery of healthcare, to use the McDonald's quarter pounder as an analogy, and then tell us what you're going to charge for it would be another great step. Whether you're self-pay, working for a self-insured employer, or you're working for the government, or you have a small group fully insured plan, it should cost the same regardless of who you're taking care of.
Well, and really we should treat it like we do any other commodity, honestly. And I know there's some haters out there that are going to say, well, healthcare is different. And maybe it is different, but that doesn't mean the consumer still shouldn't be in charge. And you said it, Jeff. Consumers need to be in charge of their own healthcare. They should not trust a doctor. They should not trust a pharmacist just because they were in the network on their insurance company. They should do their own research to see who is the best quality, the best service at the best price. And like you say, we do it with stuff all the time, whether it be a TV or a car, a hotel room. We do that stuff all the time. Healthcare should be no different. We should shop for healthcare. And our goal of this podcast is to educate and empower individuals to take charge of their own health. And that also means the financial part of it also.
Yeah, I agree. The cost of healthcare in America is crippling to the individual consumer. It's gotten to the point where no one, unless you're going for a routine visit and to see a primary care doc, anything other than that is going to set back the average American to the point where they can't afford to pay for it, right? And so, although we need to be a consumer, at the same time, we have to have a reinsurer, an insurance company, or some other solution with us in order to afford the healthcare that we need. And so I think there's a lot at work here, right? There's how do we pay for it if it's all consistent and affordable and transparent? And then how do we actually pay for it, whether we're cash pay or whether it's through our insurance company? There's so many moving pieces with healthcare. It's like landing a man or a woman on the moon these days. It's just so many things have to work, together for it to actually pan out. It's unbelievable.
Yeah, Janet, what do you have for comment?
Well, first, as I'm listening to this, just even in our local area, we make our hospital sound like they are doing this great service to their community. And I feel like we need to make them accountable because their outrageous pricing is what is getting us to this situation. I mean, if they charge a fair price, then they really would be helping their community. But when you come in and you charge people, even if it would be a copay for that matter, and most people who have filed bankruptcy because of healthcare bills, it's not like they didn't have insurance. Most of them did. What we're doing is we're bankrupting our local people, right? And if you had a fair price for the service you're asking or providing, then I would say, okay, yes, you are serving your community. But when you are doing this and the prices are, off the mark that high, I mean, that is, to me, that is price gouging at its worst. And, I feel like many times we paint this picture of that they are doing their job, but what really I think they are doing a disservice to us. And that is a sad thing because, like in our community, we only have one hospital. So that's it. We don't get a choice.
And I think that's part of the problem is there's not free market economy at work. There's not a lot of competition. Hospitals love that, especially in smaller communities. So they can charge what they want. And they say they do it out of, whether it's a public hospital, they say they do it out of charity. And that's what I find really interesting. And then they build a, $100 million hospital and still float a bond or a levy. That's what I find really interesting. So, Jeff, I think what we need to do is what about if consumers still shop for pricing? Don't you think pricing would come down on certain things? And I get it. There are certain things that are just going to be expensive. So we do need to have some kind of backup coverage. But I think even, you said outside of a primary care visit, it's not affordable. I kind of disagree with that. MRIs, for instance, local hospital, $5,000. Shop around for an MRI, you can get one for $500. ACL surgery, local hospital, $50,000. Go down to the Surgery Center of Oklahoma, it's $6,000. So, and don't quote me on those prices, I'm not sure, but usually it's about 10-1 difference. So, I think if $5,000 for knee surgery, I mean, people pay $100,000 for a car. So why shouldn't consumers pay $5,000 for knee surgery? You go.
Well, I would say the reason that I disagree with that is the average American can't afford a $500 MRI or a $5,000 knee surgery, right? We take it for granted that people have disposable income in the United States right now. 90% of the country is living paycheck to paycheck. Whether it's a $500 MRI or a $5,000 knee surgery, they're lucky to have money to put gas in their car or groceries on the table. So I'm just pushing it from a different perspective.
Right.
You look the average American, right? I'm not talking about the people who have college degrees and are making $100,000 a year. Unfortunately, that class of American is getting smaller and smaller every year. And so the challenge becomes the people that $500 is a lot of money or $5,000 for knee surgery is a lot of money. They can't afford it. Whether it's $50, $500 or $5,000, it's too much for them. And that's part of the issue we're dealing with in today's market is a lot of us, like you and I on this phone call, we probably could scrape together $5,000 if we really had to have our knee repaired. But I know a lot of people that I graduated from college with or that I do business with that couldn't. And so that's part of the issue as well, right? It's like, even if I'm a consumer and I can get it for $5,000 down at Surgery Center of Oklahoma, which by the way, Keith does a great job. And I would send everybody there. But the people who have high deductible plans, Keith's not getting paid. Right. And so that's employers have raised deductibles and raised out of pocket and raised exposure to their employees at a pace that outdoes their compensation increases to where now, even if I got a good deal for an MRI, if my deductible is $500, I go in for the MRI company's not getting paid because Jeff, the patient doesn't have $500 to pay it. I see it more, the average uncollectible debt from hospitals and physicians across the country is over 20% now. So over 20% of the time, the member doesn't pay them when they see them, which ultimately then means what? We got to raise rates to get that money back from other people. And so that was my point about the unaffordable side of it, even if I can shop for it, right?
I understand. I mean, I'm just playing devil's advocate and saying, you use the example of the TV. Well, that big screen TV people shop for, they spend more than $500 for it, and we know that lots of people like to buy a new car and have a $700 a month payment. So, I think really we need to promote. First of all, promote health and also promote consumers' priorities. And if we just keep telling them that employer or the government is going to pay for their health care, then it's never going to be cheap. It's always going to be expensive. So, and they're never going to be able to afford it. So, and, I don't know the numbers, if those are true numbers, that 20% of healthcare bills are uncollectible. Are 20% of automobile loans uncollectible, or 20% of hotel visits? I mean, these people come up with money somewhere. So, I don't think the answer is that they have to overcharge because they're not getting paid by somebody else. I mean, that's not fair to somebody like me that pays my bill.
Yeah. And you said a great word there, prioritize, right? How many of us in this country are overweight, eat too much, smoke too much, don't exercise enough, right? And then the comorbidities add up, and now healthcare is upon them. And to your point, they don't save their money to pay for their hospital bill or their physician bill because they've got other priorities. So you're right. I love that word. Americans in general need to prioritize their health, which ultimately leads to prioritizing paying for healthcare when they use it. It's lockstep with you. I see so many people that, I do open enrollment meetings all the time, and I'm talking to people about their benefits and how to use healthcare. And priority for healthcare is not in their top 10. It just isn't. No, you hear about I'm saving money for my college fund, or I'm saving money for my daughter's wedding, or I'm saving money for a vacation. How many times in your life have you heard someone say, I'm saving money for my healthcare expenditures for next year? Because there's a chance I could have one, and I need to have $5,000 sitting there because that's how much my deductible is. You never hear that.
Yeah, that is true, and I think part of it is that we have just driven home that healthcare should be paid by somebody else, whether it be employer funded or whether it be government funded. And that's where part of the problem is. So people just think that somebody else should pay for it. And that's why it gets expensive. I wrote a book about it. Because you're a podcast guest, you'll get a copy of the book, but it's called Sickened: How the Government Ruined Healthcare and How to Fix It. And, when you look at the history of healthcare, Jeff, when did it start getting expensive? Well, it really started getting really expensive after the 1960s when Medicare came into play. But in the 1940s, when there was an executive order during World War II by FDR that there was wage freezes. He put on wage freezes because he didn't want wages to go too high in inflation. And what happens when the government puts a cap on anything? You can't stop a free market. So employers started General Motors, Ford, they started offering hospital insurance. And they were like, look at this. If you have an appendicitis or you have a baby, we'll pay for it. We're going to pay for your hospital insurance. And then, fast forward 80 years later, and people just think that that's who should be paying for their health care. Well, why do you think healthcare, inflation rate has went higher year after year over the normal inflation? Because somebody else is paying the bill. And until consumers be responsible for their own healthcare, the price is never going to go down.
Yeah, totally agree.
And so tell us a little bit about AMPS. Go ahead and stream that website, Yahada. Tell us a little bit about this website and about what AMPS exactly does.
Yeah, so AMPS started 18 years ago in the medical bill review space. So looking at and scrutinizing high dollar hospital bills, which is our conversation, like you couldn't have done a more perfect setup, right? The nice thing about scrutinizing a hospital bill is you find an error 100% of the time. 100% of the time, these hospitals are upcharging or charging for things they didn't do. You hear the story about the $1,000 bedpan or the $100 aspirin, right? Those things still happen. And if the bill is not looked at and scrutinized for errors, companies, individuals, the government are going to overpay. So it's how AMPS got its start. Then about 13 years ago, we got into the reference-based pricing business, which meant the reference was Medicare. So if Medicare is $1, we're going to pay based on that dollar, something a little bit more than $1, but far less than the $4 or $5 that the BUCAs are paying for that same bill, right? And so we were one of the pioneers in exposing the bill charges within the healthcare industry and saying, you bill whatever you want, but we're going to pay you based on what the government says we should pay you for these procedures. And so 13 years ago, AMPS got into the reference-based pricing business. Then 3 years ago, we bought a really awesome, transparent PBM, pharmacy benefit management company called Drexy. And so those are our three main lines of business. We do medical bill review and coding and editing scrutiny. We do repricing of medical bills based on Medicare, and we run a full service PBM of completely transparent, non-spread, no spread pricing. So that's what it is. And the reason I came here is because I've always sought out organizations that drive change. And there's no better change agent than repricing to Medicare, scrutinizing hospital bills, and selling pharmaceuticals with a no spread model. So it's been a lot of fun being here. It's a game-changing organization.
So tell me a little bit, do consumers contact you? Do employers contact you? How does that work?
Yep. So we sell to employers, large self-funded employers, and small self-funded employers. So we work with their brokers. We work with TPAs. We will also work with small and mid-sized health plans. So, insurance companies that are regional in scope, some national in scope, that have us scrutinize hospital bills on their behalf. But our typical audience is the self-funded employer, their consultant or broker, the TPA that administers their benefits, and or the insurance company that works with them.
I see. So what do? You get a detailed hospital bill after there's a procedure or something done?
That's correct. Yep. We'll get a detailed bill, itemized bill with all the different line items by code, scrutinize that. So, a 50-year-old male, goes in for a checkup or a surgery or a procedure, and they did something that a 50-year-old male would never have done, or a 25-year-old male doesn't have to have done, et cetera, et cetera. So, the length of stay, the severity of the condition or the issue, all those things are scrutinized to review the accuracy of that procedure and the bill associated with it. And then on the flip side of that, we are a reference-based pricing organization that looks at we take every bill, right? Whether it's $100 physician claim or $100,000 hospital stay, and we reprice that code based on a Medicare allowable. And that's what we recommend that employer then pays for that procedure through their TPA.
And that's interesting. That's really cool. You can save people money like that. I just think about the mess that we've created with healthcare, and basically I blame most of it on the government, hence the name of my book. And wouldn't it be just a lot easier if, healthcare worked like every other industry, and it was a set price and transparent, and there were no surprises? And imagine how much cheaper everything would be, and how much better service and quality it would be. It's just ridiculous to me that healthcare, we let it happen like what has happened.
Yeah, I like to use at AMPS, I like to use the Elon Musk electric car story, right? So, and now we're hearing about it even more, right? So, the auto industry is on strike right now, right? UAW is on strike. They're going to demand more money, more time off, less work, et cetera, because the government is funding the EV transition. Essentially, the taxpayers are funding the EV transition. The CEO of General Motors made $30 million last year. I watched the interview that she did, and it was a joke. Like I couldn't believe it. Okay. Let's transition that to healthcare, where CEOs of United Healthcare and Anthem are making far more than $30 million a year, right? The hospital CEOs of the major corporations are making tens of millions of dollars a year for not-for-profit hospital systems. You look at the stock of Humana, United, Cigna, Aetna. It's when I left United in 2009, the stock was trading at $30 a share. Now it's over $400 a share. It didn't go up that much because they're not making money, right? And so the for-profit healthcare space, if profit wasn't the issue, if everybody paid the same price, then they would compete on quality, right? Like you know what you call a doctor who graduated last in their medical school class? You call him a doctor. I want to go to the I want to go to the doctor like Keith, who has a reputation for excellence. Right? Because if Keith Smith charges me $5,000 for my knee and I know what the outcome is going to be because he posts it online and he says, you come to my surgery center in Oklahoma, you're going to pay $5,000 for this. And here's my stats, right? Here's the complications, the readmissions, the infection rate, et cetera, versus Hospital X over here that's going to charge $25,000 who doesn't post their stats. And I have no idea what their recovery program or their outpatient services even look like because they don't tell you. They don't tell you $25,000 either because they say, well, what kind of insurance do you have? What kind of insurance you have dictates what kind of care they take care of you, right? How good they take care of you, which is absolutely the worst.
Yep.
So the electric car story, going back to the Tesla, right? Elon Musk has now been the forerunner with the Tesla. And now all the other auto companies, BMW, Mercedes, Ford, GM, they all have tons of electric vehicles. I want to know what's next from Tesla, right? He drove the market to that space and now the market's caught up. So what's next, right? And I'm waiting for somebody to do that in healthcare, right? And I like to use AMPS as like the Tesla. We started the bill review process. We started the MBR, the reference-based pricing business. And now everybody else is kind of caught up. And so this year at SIA, AMPS is going to release some new stuff we're doing. It's kind of like Tesla 2.0 for RBP 2.0. But that's why I'm here. It's exciting for me to disrupt the industry and make people think twice about, maybe I shouldn't be with United. Maybe I should give this AMPS solution a try. It's kind of like when somebody had a Mercedes-Benz S-Class forever, and they said, you know what, I'm going to give this Tesla thing a try.
Yeah. Right.
And now Mercedes has believe it or not, now they got the S-Class, which, by the way, they did a horrible job with designing the electric vehicle. But anyway, you get my point. I'm waiting for the Tesla of healthcare on a grand scale. And I think companies like AMPS are well positioned to do that and really force the change.
Awesome. So as we wrap this podcast up, Jeff, tell us if people have questions or want to get a hold of you, what's the best way to do that?
Email me at jzavada, so JZAVADA at AMPS.com. I'm really good with responding to emails, and I love having thoughtful conversations around how we can change healthcare. And when I met you at the FMA, the FMA, both of us did a great job in presenting to the audience, and I really am appreciative of the opportunity to join your podcast today. And my technology is kind of like healthcare. Some days it works, some days it doesn't. So that's why I struggled to dial in, but hey, here I am.
Hey, we worked it out. That was awesome. Oh, now you got to tell us, what does AMP stand for? It's got to stand for something.
Advanced Medical Pricing Solutions.
Oh, there we go. All right. Well, Jeff, thank you for being on our podcast. You've helped us realize our goal, which is to educate and empower consumers to take charge of their own health, which includes financials. So whether you're an employer or a consumer, you need to be watching healthcare pricing. So thank you so much for being on today, Jeff.
Thanks for having me. See you soon.
And listeners and viewers, thank you for tuning into Health Solutions with Shawn and Janet Needham. Tune into our regularly scheduled podcast Thursday, 8 a.m. to 9 a.m. Pacific Standard Time, our midweek episode. Thank you for tuning in today. Health Solutions with Shawn and Janet Needham. Thank you.